Hello, everyone, and welcome to the CoROM podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Today, as my guest, we have Martyna. Martyna has been working with the college for 3 or 4 years now, and she runs the classroom side of things in Malta. So, Martyna, tell me about yourself and your background.
Hi, good evening, everybody. So, as Cedric said, my name is Martyna. I'm Polish. I'm graduated paramedic with bachelor degree from Poland. And right now I'm residing already 7 years in Malta, so it is a quite time. And I'm working here in the private hospital, in the private sector. And as a part-time job, I'm working with CoROM, which helps me to stay a bit sane in the Maltese world. For CoROM, I teach short courses. I am the instructor of International Trauma Life Support. I'm as well instructor of Advanced Cardiac Life Support, and that's mostly what I'm doing most of the year if I'm not taking care of classroom, as well as helping with remote emergency medical technician. So that's shortly what I do.
So, how did you find the college? It's kind of interesting how you wound up with us. Do you remember how we met?
Yes, actually, I was already working in St. James for about 3 years. And since in Malta you do not have a paramedics, it was quite a challenge for me because I came to Malta with a big dream, I think very similar to yours, Ebrick, that we can actually introduce the paramedic profession to Malta. As you know, there is in Malta in ambulances, there is just nurses or just the drivers. So I had this huge dream that maybe I will have some opportunity to change that. However, the 3 years that I was working here, it revised that, and I was getting a bit down, not being able to actually doing my proper job. And then my manager in the hospital, Michelle, she mentioned like, there is this guy, Ebrick, and this college, they are working, maybe you would be interested. And she promised me to contact with you. However, I was so impatient that I reached out myself. I sent an email like, "Hey, do you need help? Do you need any instructors?" And we met in the classroom, and that's how it started.
Yeah, I remember that you had showed up after a paramedic. I think it was a paramedic day that we were teaching, and I was pretty impressed with that. You were a bachelor's degree paramedic, but like you said, you were impatient. That you had this need of finding more options in Malta, and that impressed me immediately. And then you kept showing up, like you kept coming for programs in the college, and I figured, well, one of two things: we got to shut the door and lock it, or we need to hire you. So I think I went with the easier option. So how has it been in the past 3 years working for the college?
It was challenging. I had some previous experience with teaching, let's say, but it was more about teaching lay people of the first aid, the basic life support, and I didn't have that opportunity at the beginning to work with the students. And CoROM slowly introduced me to that, which I realized that I really, really enjoy. Sharing the knowledge and sharing it with students, seeing how they grow, how they progress, because many of our students that they started with a remote emergency medical technician, they progressed as soon as CoROM opened the bachelor degree. They starting attending the bachelor, and I think now slowly some of them, they will be graduating. So it is satisfying. Some of the people who did ramp, they end up working with me in the hospital. So it is actually it is nice to see that my knowledge that I share, it benefits somewhere in the world.
So you have a few of our REMS graduates working for you. what level are they working? What are they allowed to do as remote emergency medical technicians?
I mean, we're working as they graduated as a REMT, remote medics, but the two that I have in mind, they work in the ambulance in the private sector. Our our skills and what we can do, unfortunately, it is limited. However, since we are working in the private sector, the company and the managers, they are allowing us to do a bit more, and there is a promotion opportunity that's coming my way to become a senior paramedic in the hospital, and I will try for sure to push for that we will be able to do a bit more, and with time maybe I will manage to get more paramedics in our hospital. Like I told you, I never gave up my dream that we will be able to introduce the paramedics in Malta, and I think starting small, that's the key to do it. So unfortunately, for now, we are just providing qualified first aid in the ambulance. We will do the parameters, the ops. We will check up the patient. We can provide the basic life support with the AD. So as you see, it is not much. It is not much. However, then in the department, under supervision of the doctor, sometimes we can a bit close the eyes and do a bit more, like give the treatment and etc. stuff. But there is so much more that I would want to do, and I will be working hard to open that options for us.
So I didn't know they're putting you in a senior position, senior paramedic position, and they're going to let you have your medics, your EMTs, do more in
I
the
mean,
private sector.
this is still in progress. There is still an interview to be done from the official part, and I have to see how the HR see that position. However, I would want to push for more. I can see that there was a change in the management, and they are more open for a changes. They want improvement, and I will for sure push for that. I don't want us to go backwards, that there will be just an EMT and we will be providing first aid. There is a potential. There is a potential, and I think they just need the person who can show them that it can be better and we can do actually good paramedic job.
That would be fantastic. It's been a passion of mine to do that ever since I moved to Malta in 2014. Lived there for 3 or 4 years. In fact, the college was invited down to Malta from Ireland because the then head of the emergency department, Dr. Kassar, wanted to implement paramedics onto the ambulances in the Mater Dei Hospital, and we moved everything down and we started putting paramedic students into the A&E and on the ambulances, and then the nursing unions got involved and stopped everything. So it's been at a standstill.
Yes, I realize that we have very big dream, and Malta is a very small island. So unfortunately, here everything, whatever we want to do, it have to be very slow, and we have to be very patient. And that's what I learned for the couple of years that I'm here. That if we want to achieve something, it cannot be rushed. And everything slowly, slowly, step by step, and if it's gonna be in 30 years time, it will be satisfying if I will have some part done for that. But yes, patience is the key here. I believe so, because as you know, you hit the wall with the public hospital, especially with the nursing union. However, I know that there are people right now, especially in the University of Malta, that they seen how much paramedics are of benefit and how much knowledge we have comparing to the nurses. The nurses, after 3 years of here of education, of having a bachelor degree, they do not have much experience still in emergency. Then they have to do several courses. They open right now the master for emergency nursing here in Malta. However, this master is, as far as I am aware, is built up with many little courses like international trauma life support, advanced life support, and etc. stuff. So I think still after having that master degree they are not having that kind of knowledge that paramedic can provide after 3 years of studying. So it is not about pushing the nurses out of ambulances because we should work as a team, but it is about the improvement we can introduce and give better care to the patient. Because what people don't realize that if we're speaking about Malta, even though there are so short distances between hospital and the end, one end of the island, since we have terrible problem with the traffic, the transport of the patient, it is not matter of 10 minutes, but sometimes it is matter of 20 minutes, which for the patient in pain, for the patient in the septic shock, for the patient who is nearly arresting, this 20 minutes can mean whole life for the patient.
So at the moment, what can the ambulance nurses do for the the patient in pain or the patient with sepsis? Are they allowed to give treatment, to give drugs?
So let's focus on one case. If it's coming to the pain relief, unfortunately, it is just Antonox that it can be given. I believe there is a possibility maybe for giving a paracetamol, but this is non-official way of acting because a nurse officially cannot just decide about giving drugs to the patient without the doctor prescribing it. So I think maybe paracetamol can be given if they will communicate that need through the phone. However, no other drugs they are involved. So the nurses they are not even carrying, for example, opioids in the ambulance. In Malta, I think the Pentrox is not even available to
Wow.
be sold in the pharmacies. So the options are very limited. So we just staying with Antonox clearly.
So these ambulance nurses, and some of them are friends. I mean, they're really good people. They're highly motivated. In fact, the Emergency Nurses Association has hired our college to give additional classes because they want this knowledge. But you're saying after a master's degree in emergency nursing, they can't give opioids, and they need permission to give IV paracetamol.
Yes, so there is a bit of like a fight and discrepancy between nursing union and Malta Emergency Nurses Society. So, like you said, the highly motivated nurses, they want to learn, they want to improve the skills, and they are intelligent, skilled people because I had an opportunity to give to some of them international trauma life support course, and actually I was very impressed with the level of the knowledge. However, they are so restricted, and there is a pressure from nursing union towards them to not use that skills. Most of them, they will not even cannulate in the department or in ambulance because there is a fear of being reported by the other colleagues. So nursing union is pushing basically nurses to not cannulate people. I know that the nurses working in the emergency department is a bit of let's say different group. They will do a lot like me in ambulance. Non-officially, but whatever we're doing non-officially, we're risking our license basically.
Wow. So they can cannulate, but they're worried they won't cannulate due to the political pressure.
Exactly. And funnily enough, because as you know, I am finally gave up a bit and I'm doing my nursing degree here in Malta. And the time that the nurse is spending learning cannulation, it is a 145-minute session on the dummy, and that's it. Then
Wow.
during the program, there is not really much opportunity to practice that because depend where you are placed on the placement. In the most places, they just saying like, no, this is the job of the doctor.
Wow. And does that go for airways as well? They can't put an LMA in or an iGel.
No, if it's coming to the emergency, the nurses can. They can do the LMA, they can put an iGel if they have them available. However, again, depend of what nurses we are speaking. The one in emergency, they will be putting LMAs and iGels without asking the doctor. They don't have to have a permission. However, if you will go to the wards and there will be, for example, patient in cardiac arrest, um, they don't need a permission, but they do not have a confidence and knowledge with putting supraglottic airways. Unfortunately, a lot of nurses here, they're relying on the doctors. Like I'm saying, this is separately from the nurses from the emergency department or from the ITU, because that nurses, they are really highly skilled.
And I know that the European regulations for nursing is 2,300 hours of clinical time in order to graduate as a nurse. And you're saying after 2,300 hours, they're not comfortable cannulating or giving drugs.
No, but you have to as well. We have to now look at it about the students. For example, I have right now under my supervision a student from Erasmus in St. James. She's an EMT student, but um, she do not want to do practice. She just want to fulfill her hours. And I seen between my colleagues nursing students during the clinical hours that a lot of them, they just don't want to try, they don't want to do. And the nurses, that's how they treat them. If you don't show me that you are interested in the stuff, I'm not gonna force you. It's fine. I'm gonna sign your hours, sit there and don't do anything. But as well, like for example, even if the nursing student will say like, listen, I want to do that, but their mentor particularly, he's not comfortable with the cannulation. First of all, we won't be allowed, and second of all, we won't be looking good in front of our mentor, who is at the end of the day giving us the final mark at the end of the placement. Plus, you have to think about where we are placed. So I am on the third year part-time right now. So in Malta, part-time is taking 5 years. And I was placed in St. Vincent de Paul, which is the complex, big hospital complex for the care of the elderlies. I was placed on the dementia ward. And I couldn't really do anything from my clinical nursing skills. I was just exposed to washing the patients and assisting the patients with the daily tasks. And there was maybe one patient who needed a change of dressing. That's all. My second placement was in the healthcare clinic, where again the same. I was checking the parameters. And I was just taking blood, and I was allowed to take the blood because I have a previous experience of as a phlebotomist. The other students, they were not doing anything. They were just standing behind behind the nurses and just observing. My next placement is gonna be in the Mont Carmel, which is the psychiatric hospital here, and we are not allowed there to do anything because of the quality of patients they are there. So obviously, the access for the needles, the cannulations, taking blood is really restricted. So again, as you see, if you are not placed in emergency department, if you are not placed in the medical ward, which having a patient, more serious patient, there is not much opportunity to actually practice the nursing skills like cannulation and etc. stuff.
You have the patient of a saint, Martina. If you have the skills to intubate, to give cardiac drugs, you're an ALS level paramedic, and you're in a clinic where you're not allowed to do anything, and that can be, I'm sure that's aggravating, isn't it?
Yes, but that's why it took me so long to actually decide to start nursing degree here in Malta. Because for these 3 years, everybody was telling me like, "Oh, you should start nursing. You will earn much more money, and you will be able at least to use some of your skills." But I was so stubborn, and I didn't want. But these 3 years teach me actually that there is no point of being stubborn, and I like the saying, the drop of the water is actually shaping the rock. I'm not sure if how that's how you're translating it to English, but if I want the shortcuts, I will not go anywhere. If I will be slowly just following and have my targets set up somewhere there, I will achieve them and I can be a change, but it's gonna take time. So, yes, the Malta, I have to say that they teach me a patience. Definitely, I learn a huge amount of patience here.
That's a good lesson that after 50 some odd years walking this planet, I need to relearn that myself from time to time. So it's admirable that you have that. So you are also not only you're doing a nursing program, but you're also doing our Masters of Critical Care. How has your experience been on our program?
So as you know that for now, all I am in the middle of the first year. Because of my wedding, I had to slow down a bit. However, the first semester it was so amazing experience, and I'm talking for now about just the lectures, because the first semester there were lectures which they were delivered online, but the amount of specialists from the different backgrounds and from the different clinics and from the different part of the world that the CoROM is introducing to that program, that they are delivering lectures for us. It is so amazing experience, because we can see the approach from the different point of views. We have a lecturer from Africa. We have very skilled doctors who are delivering the lectures from Hungary. We have Dr. De Mello from UK. So the amount of the experience that we can get from that people, it's amazing. And even different cases, the cases scenario that we are working during the lectures, actually, even though they happened last year, I still remember them. And that's the best learning experience, I think, because we learn through our mistakes and we learn through the experience of other people. So it is a very interesting program, and I'm looking forward to see more. What is ahead of me? I know that we will have to go through the ultrasound course, which is very interesting. This is the future of the emergency and critical care medicine. In the past, like 10 years ago, no, we were just talking about is that it would be amazing to try to have the fast ultrasound in the ambulances. And right now in the world, it's happening. It's making it so easy actually to diagnose certain conditions that before we just had to assume and we couldn't do anything for this. Like, for example, cardiac tamponade. There were few crazy people that they try to help the patient with the cardiac tamponade in ambulances, because we didn't have a tool actually to visualize where we are putting the needle. Right now, in Poland, for example, in many ambulances, there is portable ultrasounds, and the quality of work and the quality of the care we can deliver to the patient, it's amazing. So CoROM, in their master degree, it's giving so much to learn, and it's not just a master degree which I could do in the university in the UK, for example, because it is not just clear critical care, so how to take care patient in the intensive care unit, but it is so I don't know how to say it. There is so many informations in it. There is a part of tropical medicine. There is the critical care in the intensive care unit. There is the ultrasound. So it is so many informations in that short period of time that it is amazing for somebody who really want to learn something. It is amazing.
I remember that you took our IQ Butterfly from the classroom and brought it over to your hospital. Were you able to do some? Were you able to use it? Were you able to do any good with ultrasound on your in your practice?
So I was trying to use it as much as it was possible, but obviously I am restricted with the quality of the patients we are receiving in our hospital. Since it is a private facility, I am kind of restricted with the cases we are accepting. And I was a bit restricted with the doctors because I cannot just step in the role of the doctor in our hospital. So I had to first ask particular doctor of permission, like, hey, do you want to try? I have this, we can have a look. And a lot of doctors, unfortunately, they were so not just not confident, but even scared about using it because they didn't know, they didn't have the knowledge, so they didn't even want to try. So that was really restricting, unfortunately. So I cannot give much of my experience from that. I could see and try to cannulate the patients with the ultrasound. It was actually very helpful for me when I was doing my phlebotomy part of job, because there we experiencing a lot of patients with the difficult veins and especially children. So that I could use it for. And obviously check patients with the abdo pains to performing the ultrasound. However, I didn't have an opportunity to use it in some major accidents since my hospital is not accepting that kind of cases. It's a bit of a Russian roulette, what I'm gonna experience during my shift. Sometimes it's nothing, and sometimes everything is just out of this world.
Fair enough. Are they using ultrasounds in the mater day and on the ambulances in Malta?
No, unfortunately, they do not have it. Um, as far as I know, in the emergency department in Mater Dei, there is, I think, just one or maybe two specialists that they like to use the fast ultrasound. But as well, I heard from my other colleagues, doctors who are working sometimes the shift in emergency department, that it's not seen as something positive. They actually, I remember one of my colleagues, the nephrologist, he was actually saying that this guy, he always wants to try the fast ultrasound when we have a recess and he is just wasting the time. I do not see
Wow.
it like that, but it's very actually worrying that the other doctors, who are actually young doctors, the future of the medicine in Malta, they see it in that way, that it's a wasting of time. And at the end of the day, you have to practice something somewhere, you know. So even if it was seen as a slow skill, we have to practice. However, I had an opportunity as well, I think this year or at the end of the last year, to help during the ultrasound course in Mater Dei for the nurses and for the doctors. So there is a growing interest in this area. However, I am not sure how it is supported from the management, because you can have skilled professionals with using the ultrasound. However, if you will not have an access to the fast ultrasounds, to the portable ultrasounds, that's it. You can have a knowledge which you will forget after half year of not using it, actually. So there's a lot of place for the improvement. I think it is slowly changing in Malta, and there is a hope and there is a chance for the change.
That's surprising that this it's just not being embraced when there's so much evidence out there showing the benefits of ultrasound. Um, Surprisingly, the armed forces of Malta have asked us for our APIS ultrasound course, and Dr. Danielle Wilhelm and I are going down later this month to run the first ultrasound course for the military in Malta, and hopefully they'll see the evidence and see the benefits for using it.
I think, like I told you, it's small steps in Malta. So you starting with the armed forces of Malta. I heard, like I told you, that we had recently change of the management in the hospital, and there is a bit of a fresh blood, a bit of fresh view. And actually, my department is trying to get portable ultrasound to the department. Unfortunately, for sure, it's not going to be available in the ambulance. But even though they are looking into that, and obviously I am trying to push the other doctors in our department to sign up for the CoROM courses of the ultrasound, so we can actually provide much better care for the patient. So small steps. If armed forces will be trained, my hospital, which is a small private hospital, will be trained slowly. Slowly, I think it will be much more wide use of it in Malta. So maybe not next year, maybe not in 2 years' time, but maybe in 5 years' time it will be common.
As you say, the water breaks the stone slowly.
So we just have to stay positive. That's what is helping me to survive in Malta. That slowly, slowly, and you will get where you want to be.
So, looking big picture, so we talked about your master's degree. We talked about what you're doing in Malta. Um, Looking at the college now that you've been working for us or with us for 4 years, what would you like to see differently? What would you like to see the college do that it's not doing right now?
I mean, seeing college, the progress of college for the last 4 years, like we started with our classroom being in a different state than it's now, and just doing very rarely some CPD courses. And 4 years passed, we starting ultrasound courses. College opened the bachelor degree for paramedics. They opened the master degree, and we are opening PhD program. This is an amazing improvement, and even you can see it in our classroom. So it is not. I don't want to say like I want college to do something differently. What I would like to see more students signing up and more local students, because I think that would we would benefit a lot from that if we would have more local students, and we could like this change actually how Malta is seeing how Malta is providing the emergency care to the patients. So I think wider promotion locally, but it's like we know it is hard. The Maltese people are very a bit close society, and they don't like much newer thoughts. They have to slowly process it. So I think CoROM is doing amazing job. The last 2 years, we pushed so much for the new degrees. So I would like just to see it growing and still going that fast or even better.
I would be delighted to see more local Maltese enroll into our programs, specifically the paramedic. But I don't see the, uh, the I couldn't even let them in if they applied because they would say what jobs are available. And in Malta, which there are very few jobs, our graduates are getting work on cruise lines and oil rigs and um, for ICRC, Red Cross or UN, but nothing in Malta. So I would like that as well. But I also we need a horse and cart thing. Of the problem is a horse and cart thing. So we need jobs in Malta for paramedics before we can start putting people through our paramedic program. So that my passion is similar to what yours is, which brought me to Malta in 2014, was to create paramedics. I just don't see that happening quickly, but hopefully I can adopt the patience that you've shown for your medical pathway through Malta.
I mean, it's true that it's a huge problem that we do not have the jobs for paramedics. But like I'm saying, slowly, we have to start small, and there is a chance. If somebody locally would like to do that course, obviously they have to look for the job somewhere else, which a lot of people do. However, Maltese people as well, they don't like to move abroad, and they are very family orientated, and they just like to stay here. That's why not many of them choosing paramedic course with college. But I am positive. I am positive about that in the future it will change, because as well, when I started with CoROM, we didn't have a lot of multi students even doing the short courses like ITLS or ACLS, and COVID showed increased in the amount of multi students actually who participated and undertook the courses with us. So a lot. I think it depends of the promotion, and I like to believe that I have a chance to change something in my workplace, which, like I'm saying, it can be a small step for the improvement somewhere in the future in Malta. And when I will graduate my nursing degree, and hopefully I will get a job in the public hospital, that I will be able to make a contacts and slowly move it a bit forward to show them that the paramedics they are a key for good care for the patients.
Well, you continue to have the support of the college as you move towards that aim, and I'm impressed with what you've done in the time you've been with the college, and I look forward to seeing you also have an influence on where CoROM goes and how the college develops in Malta.
I hope so too, because how much I did in this 4 years and how much college gave me, the opportunities, the instructor role, this will stay with me forever. And I still have an options for the improvement. There are new courses coming up that I still didn't do, and they are ahead of me that I can participate with them. It's a huge opportunity for me. If not college, I would not be where I am now, definitely.
That's a profound statement. I appreciate that. Thank you for your time this evening, and I look forward to seeing what you can do in the next 4 or 5 years.
Me too. But step by step. Step by step.
This has been a presentation from the College of Remote and Offshore Medicine Foundation. If you would like to earn CPD credit for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credits, free access to the virtual field guide, and discounts on our e-learning courses. You can join the team on the college website, which is CoROM, CoROM, corom.org.